ARV dispensing. Are we ready for that at the government? Thank you.
My response is very short. When the policy is finalized, it will be disseminated. But there are a lot of pilot studies going on. But for the time being, we'll communicate, and when the policy comes out with that evidences, I think it will explain very clearly. But with the pilot findings, I hope this will happen soon. And the Minister of Health, in collaboration with the agencies or the department that and Minister of Health, will provide that policy statement. Thank you very much.
Thank you so much, my presenters, for well narrated and designs what has been done in the collaboration of government and private, enhancing HIV services delivered across our country. Maybe USAID, if you have a word from USAID before we wind up.
Distinguished panelists and ladies and gents, my name is Godfrey Nyombi. I'm the head of health system strengthening in USAID. On behalf of USAID and managers of Afya Yangu and Kizazi Hodari, would like to thank you all for having a great panel. Thanks for the great panelists here and the comments that have been raised. And I think, as we have heard both from practitioners and the government and private sector, that together we believe the healthcare system is built by both sectors, both public and private. I think one of the comment that was raised here is like perhaps we have to agree that we cannot exist, one cannot exist over the other. We all need each other to make sure that the services that we're targeting to each individual Tanzania, we get them to the quality that is expected. So we believe working beyond private sector, beyond profit, private sector for profit. We believe working with foundations, but also on non-profit, faith-based facilities and so forth. And we naturally, as practitioners, are normally inclined to the public sector. So I think most of us maybe here have experienced mostly the life of the public sector, but I think this is one of the opportunity for us to learn and be good advocate for the private sector beyond the profit and beyond financing or getting money from the private sector. We believe private sector is not only a sector by itself, but it's also a practice that the government can deploy some private sector modalities or private sector practices. In some government facilities or public facilities, they've already modeled like different practices that are private oriented, like businesses, the way they run the businesses, the way they segment the markets, like the clients who can pay more gets a different part of service for the leverage of those who cannot pay more. So I believe all of us can practice private sector in a way that we can. We believe that we can learn from the way private sector is doing things. As we're looking into sustainability, we really have to look into like the business mindset in us. Like how can we deliver the healthcare services in the business mindset that allows us to be more effective, more efficient, and yet deliver high quality of service? Because that's the mentality of the private sector. It's quality of products, end of the day. It's the quality of service. So we can learn from that mentality. That's how we can be efficient and effective, but also we can deliver the big quality. I think also we should leverage on collaboration more than competition, because I think end of the day, if we have to compete, maybe we should compete on compliance and compete on quality of care. So that could be, I think, a good way to improve the quality of services, because facilities are competing among each other, both public-private or public-public or private-private, around areas that are going to improve the quality of care. Lastly, I would like to say that the definitely, I think Dr. Mfome just answered one of the great questions that was asked about opening up for more private sector practice in the HIV response is a good way to sustainability. I hope if we get a great environment, a good environment for the private sector to practice, including policies and systems, it's true and it's very important for the private sector to practice, for example, on the HIV responses, but it's important also we get the system to support that provision of services as well. So let's work together to create that good environment.